Good evening from New York. Anyone who still holds out hope that the Republicans might be serious about health care reform, please refer to Hatch F7, one of the 564 amendments that members of the Senate Finance Committee have introduced to the Baucus bill, which would, and this is not from The Onion nor The Daily Show, which would, quote, add transition relief for the excise tax on high-cost insurance plans for any state with a name that begins with the letter U. Our fifth story in the countdown, Republican Senator Orrin Hatch representing the only state in the union that begins with the letter U. And so it begins, the next phase of watching government sausage being made among the hundreds of amendments. Republican Senator Snowe and her so-called trigger option for a public plan getting the most attention today. In amendment speak, a provision of safety net fallback plan to ensure access to affordable coverage. Other senators on the committee, Democrats, calling for the creation of one national exchange, otherwise known as the public option, outright. Yet should his amendment covering Americans of all ages fail, Senator Rockefeller also calling for universal coverage for children. Meanwhile, Senator John Take-Me-to-FedEx Ensign, Republican of Nevada, resisting the temptation to extend health care to mistresses, staffers, and especially mistress staffers, asking simply to strike the word fee everywhere it appears in the bill and replace with the word tax. Well, that would certainly make it easier for him to argue against the measure later in an effort to defeat it. Yet you might think Senator Ensign might want to pass the bill if his amendment calling for transparency in czars survives its snowball's chance in hell of surviving the markup process. Various proposals that would either exempt certain workers from the excise tax on high-cost insurance, the so-called Cadillac plan tax, or make changes to it, paid for either by capping itemized deductions at 35% or closing corporate tax loopholes. Many, if not the majority of Republicans, not even bothering to provide offsets, literally leaving those ways of paying for it blank when all they seem to do is talk about how much government costs. Meanwhile, Senators Kerry and Schumer would replace the free rider provision with an employer mandate. That would require all companies to provide health insurance. As it stands now, the so-called free rider provision would penalize employers that do not offer insurance only if their employees obtained government subsidies, which could have the perverse effect of discouraging employers from hiring workers from low-income families. Senators Grassley and Kyle both looking to eliminate proposed fees on health insurers. Well, not just the insurance companies, but also all medical device manufacturers, misspelled, clinical laboratories, and pharmaceutical drug companies. Senator Grassley suggesting this be paid for with money that has not been spent out of the, wait for it, Stimulus Act, the same Stimulus Act he voted against. This proposed offset from the same man who in March believed a 3-year spending freeze would be the best way to fix our economy, otherwise known as the Depression Express route. In one of their amendments, Democrats Schumer, Menendez, and Bingaman proposing the, quote, inclusion of Puerto Rico and the territories in the exchange. Wait until the right wing gets wind of that. Who would like to be in charge of explaining to Congressman Joe the Heckler Wilson and the rest of the immigration bunch that places like Guam and the U.S. Virgin Islands and Puerto Rico are part of the United States? You don't even need a passport to get into them. Over the weekend, President Obama discussing health care reform on all of the key Sunday morning talk shows. On Univision, he said that the Republicans have already made a political decision to oppose his plan, no matter what is in it. On Meet the Press, he repeated his previous claim that there is agreement on 80% of what has been proposed. And tonight, with David Letterman, the president touching on President Carter's contention that part of what is fueling the right-wing rage in this debate is race.
I think they just want to see some comments.
First of all, I think it's important to realize that I was actually black before the election. So,
really,
this is true. So,
how long have you been a black man?
And so the American people, I think, gave me this extraordinary honor, and that tells you, I think, a lot about where the country's at. I actually think that what's happened is that whenever a president tries to bring about significant changes, particularly during times of economic unease, then there is a certain segment of the population that gets very riled up.
Also on Meet the Press, House Minority Leader Boehner declared that the public option is dead, but he also refused to say that President Obama is a socialist, even though he has said just about that in the past.
You really think the president's a socialist?
Listen, when you begin to look at how much they want to grow government, you can call it whatever you want. But the fact is
what
that
do you call it, though? This is
unsustainable.
That's fine. Do you think the president's a socialist? That's
No.
Okay, but the head of the Republican Party isn't calling him that.
Listen, I didn't call him that, and I'm not going to call him that.
Time now to call on our own Lawrence O'Donnell, contributor to the Huffington Post and, of course, of MSNBC. Good evening, sir.
Good to be here, Keith.
Senator Baucus said today he intends to ease the financial burden that his bill would impose on middle-income families, that basic $13,000 tax, or up to $13,000 max tax, as it has been called. Among other ways, he thinks more subsidies would be paid for by paring back the amount of deficit reduction in the legislation. So instead of the socialism of a government option, we would just take federal money that would have been used to pay down the deficit and give it instead to the private insurance companies. I mean, if you're going to have to bribe the private insurance companies to make private insurance affordable, isn't it still government insurance, only with no control or oversight?
And most especially, no price control. So this is the government subsidizing the purchase of a product from an industry which gets to just pick whatever price it wants for that product, thereby making the subsidy work or not work, or putting political pressure, again, to drive the subsidy up higher. I mean, this is an unworkable situation. The idea that the insurance company's product, is unaffordable, therefore we will give people money to buy the unaffordable product and then leave control of the price in the hands of the insurance company executives. So this is a hopeless situation.
As this would play out, the health insurance lobby would now get to go after Democrats for subsidies to make the Baucus bill affordable for the middle class. Meanwhile, it would lobby Republicans on the absence of a government-run plan, and it stands to profit billions, pretty much win or lose. This is more health care reform for insurance companies, basically.
This is a dream for the insurance companies. They won this game before it started, because before it started, the president and the so-called practical Democrats in the House and Senate ruled out the possibility of simply opening up Medicare. That was Anthony Weiner's idea. That was the idea of the liberals in the House. It was Senator Kennedy's idea a couple of years ago before Barack Obama got elected. But the wise men decided we shouldn't go with that simple, explainable thing, because they might be accused of being socialists if they do that, and now they've ended up with the ugliest bucket of socialism you could possibly have written.
And now, of course, they still outnumber Republicans on the Finance Committee 13-10. So how do Republicans win in the next step, this markup process, if the Democrats don't also don't essentially let the Republicans win in markup?
Well, there's only one way for Republicans to win an amendment in any committee, in the House or Senate, and that is Democrats have to vote for that amendment. In the case of the Finance Committee, you have to get at least 2 Democrats to join a Republican amendment. There are some possible candidates for that as this thing moves along, and so we'll see how they get their amendments in.
What else should we look for during the markup process this week? Who or what should we be looking at?
Well, what it's come down to in many ways is a standoff between Senator Rockefeller and Senator Snowe. If Olympia Snowe gets her way, Jay Rockefeller will vote against the bill. If Jay Rockefeller gets his way, Olympia Snowe will vote against the bill. This is over the public option, whether it'll be real and in place or triggered, as Olympia Snowe would go for. The other person to watch who's been ignored all year is Blanche Lincoln. She is possibly the most conservative Democrat on the Senate Finance Committee. She's from Arkansas. She's in a tough re-election situation there next year. She has not been forced to comment and take hard positions on any of these things. She has come out against the cap and trade bill that has been passed by the House of Representatives. So she is definitely the one to watch in terms of the ability to be peeled off by Republicans for some of their amendments, and possibly vote against this bill on its way to final passage. If Chairman Baucus loses Jay Rockefeller on the public option for final passage of this bill out of the committee, then he needs every other Democrat. He can't lose one, and Blanche Lincoln is very iffy.
Yeah, and Senator Lincoln with another one of those huge ratios of health sector donations compared to overall campaign donations, so you can see where that's turning out. Lawrence O'Donnell of MSNBC and the Huffington Post, as always. Great, thanks, Lawrence.
Thanks, Keith.